credit of only 202 as opposed to 470 for the person who's much lower income. And their deductible and out-of-pocket maximum pretty close to the same thing. And the insurance, you know, your primary care doctor visits and stuff, you're going to pay, but you're going to pay the negotiated rate for the insurance company, not the list price. So you have to pay pretty much everything up until you hit about $6,000 a year. Same on prescriptions. So if you use a lot of prescriptions, a bronze plan like this is not going to be for you.
Basically catastrophic.
Nearly, yeah, that's what I'm saying. Okay, so for a 35-year-old with an income of $28,000, also here in Garvin County, they get a tax credit of a little over $200 a month, and their monthly premium would be $176. Their deductible is $5,000 a year, and the primary care doctor visits are $30, no charge for generics, so they don't have to get all the way to that out-of-pocket maximum before they start getting some benefits. So that's a preferred silver plan. Now let's go back to the 50-year-old making $28,000. This is the difference between the networks. Blue Choice is the network that includes Pauls Valley Hospital. Blue Preferred does not. So
you'd have to go to, which hospital does it cover?
good question. Up in Oklahoma City, I think, is the closest one. Now, for emergencies, people can go anywhere, and then you get transferred. But say you needed to have your gallbladder out, you wouldn't be able to do it in Pauls Valley Hospital without paying extra for that.
But it still wouldn't be more than the $6,300.
No. Well, no. If you go out of network,
That's a whole nother ball game.
Okay.
So
But that's real important to know what hospital.
So Blue Choice.
Yeah.
If I were in
You
Pauls
have to go all
Valley
the
and
way
I was
to
over, maybe 40, I might decide to take this one. If you're pregnant, you wouldn't want to have to drive to Oklahoma City to deliver your babies.
Well, see, they don't even deliver babies at Pauls Valley anymore. No. I don't know where they're going, but they're not going there.
Ada or Ardmore.
Oh, okay.
Silver does not.
I didn't.
Intercel's not there.
I didn't. I was born at Norman Hospital, so I don't know, but I'm sure
That's been like the last year that happened.
So you can see on the choice plan, they get a subsidy of $125 a month, lower out-of-pocket costs at $5,000, and their primary care doctor visits are $30, and generic prescriptions of no charge. So that's the difference in the network. So Blue Preferred doesn't have Pauls Valley Hospital. So the premiums, you can see it's the difference between $232 and $273 for essentially the same plan. But it's just the size of the network that makes the premium higher. So that's something that people who don't deal with health insurance all the time don't always understand. If it were me and I had a specific doctor I wanted to go to, I would call that doctor's office and find out which network they're on. So if you don't care what doctor you go to, the doctor will do. You don't have to do that, but if you've had a relationship with a doctor for a long time, find out. Don't sign up for something and then it's like, oh, my doctor isn't on that, you know. So, going back here, see where that red arrow is? If you click on details, what you go to is a thing that looks like this. And it gives you summary of benefits, brochure for the plan, provider directory, which will tell you what the insurance company thinks their network is. However, that can be different than what the doctors think the network is. So make sure you check with your doctor. And a list of the covered drugs. So if you're on medication, you want to check that. And what it does when you click on that is it takes you to the Blue Cross Blue Shield website. And that gives you all kinds of information about the Blue Cross Blue Shield plans. Okay, Going back, if you click on the details, it shows you that one little thing that takes you to the Blue Cross thing. But it also gives you this. It gives you the deductible per individual, 5,000 per family. And that per family is if you have a family of 2 or a family of 20. It doesn't matter. So the bigger your family, the bigger a good deal it is for you. The prescription plan deductibles of 0 mean that it starts paying for prescriptions right away. The out-of-pocket maximum, 5,000 we talked about, and the prescription drug out-of-pocket maximum is in the medical. Further down the page, it tells you what your co-payments are. A co-payment is a fixed amount that you pay, like $30 for a doctor visit. A co-insurance is what you pay that's a percentage. So if it says 30% of your inpatient bill or something, which is going to be a lot of money. But it's only up to your maximum, so that's a good deal. This doesn't have any co-insurance on there, it just has copay. So a generic prescription, no charge, preferred brand, $50, non-preferred brand, $100, specialty prescription, $150. So counts towards your maximum, you know, so if you really need a drug and your doctor can't substitute a generic. So Garvin County has 7 bronze, 7 silver, and 7 gold Blue Cross Blue Shield plans. And like I said, the preferred network does not include Pauls Valley Hospital. They have some other plans on there, like it's called a Blue Cross multi-state plan or something. And I couldn't for the life of me figure out what their network was. So if I were interested in that plan, I would call Blue Cross Blue Shield and talk to them about it. So here are the important dates. January 1st, coverage started if you signed up by December 24th. January 10th, you got to pay a premium. March 31st is the last day to sign up until October of this year. So if you procrastinate and wait till April 1st, you can't sign up. Unless something changes in your family. If you get married, if you lose your job, there are a lot of things like that that you would be eligible to sign up if your family circumstance. You have a new date. So, okay. So, if you know, there's a lot of misinformation on both sides, really, about the Affordable Care Act. Some people say it's the best thing since sliced bread, and other people say it's the worst thing since I don't know what. And, you know, the truth is kind of in the middle there, I think. So, if you learn something today, tell people about that. I've got some brochures. One of them is from Be Covered, Oklahoma. That's both in English and in Spanish on the other side. And it kind of has some of the basics of health reform for people that don't understand it. Because Blue Cross Blue Shield is the only insurance option for people who live in this area, or at least in Garvin County. I didn't check any of the surrounding counties, so it could be different. Blue Cross Blue Shield has a nice little brochure that they put together too. So if you know people who need insurance and they need maybe a little nudge to get them, you might give them that. If I lived in a small town in Oklahoma, I would be calling my state senator and my state legislature and saying, you need to expand Medicaid. You're going to hurt everybody in this town. And I don't want to be, and I don't think you want to be, the senator from Pauls Valley that ended up being the reason the Pauls Valley Hospital closed. So, you know, I think that Medicaid expansion, it's our money. We can take it back. It's a great deal for the state. The Hospital Association is big time behind this. If you go to the Oklahoma Hospital Association, and they really, really, really want this because it's going to save their hospital. They don't want to lose a bunch of rural hospitals. Download flyers and brochures, postcards to give to friends and family. We've got some at doctorsforamerica.org. You can give this talk. I'll give you the slides if you want them. At a library, at church. Invite someone to give a talk. Or write a letter to your local paper and say, people need to know this stuff. And if you all have other ideas about what you can do, I would love to hear those. Just spread the word. And if you have questions, I'm more than happy to take them down.
I have two questions.
Okay.
And I have to set that for a moment. The reason why is behind the first question. What about people suffering from mental illness? Does this cover mental illness?
They're covered.
It covers mental and it covers substance abuse as well, which is a big problem in Oklahoma.
This person I'm thinking of, the first person is on cemetery.
Oh, okay. Well, then he should be able to get it through that.
All right, next question. I have a sister, single, no income. She's living with my mother. She's a homeless person. She needs to have a total knee replacement. I told her, I said, you need to get on. I told her this before the December 24th meeting. You need to get on the website. And she got on there and said, I can't sign in because Oklahoma does not. And that is
That's the reason we need to expand Medicaid.
Yeah.
She could be.
Her knee looks like a football.
She needs to move to another state.
I told her, I said, we're living in the wrong state.
Well, Arkansas is expanding Medicaid. I'm going to tell you, if I were a real poor person and I were single and I had any option to live in the state that is expanding Medicaid, I would be moving. And what company is going to want to move, especially if they have lower income employees, to Oklahoma?
Why did Mary
I think
Fallon
it's-
reject it?
Pardon?
Why did Mary Fallon reject it? She tried to take it at first, but.
No, that was
No, she
the
did
money
not.
for the marketplace.
Yeah.
She didn't try to take Medicaid.
She sure did not.
She's not wanted to take that, and and I think that had to do with a just general dislike of anything with President Obama's name on it.
Right.
And this is called Obamacare, and that is toxic to. And I think she may have been trying to avoid a primary challenge in the upcoming elections.
But she already got it.
So how does the money to expand Medicare come from? I mean,
Medicaid. It comes, it's 100% of all the newly eligible people are covered for money from the federal government that comes to Oklahoma and pays their bills to the hospitals
So
and the pharmacies
Get
and the
that
doctors.
She can get it any time.
She can get it any time. She can change her mind any time.
Why were they not covered in the first place when they first started Medicare? Why was it all these low-income people?
Medicaid,
Medicaid, why weren't they all covered?
They weren't 65.
the states have the choice of how generous to be on their Medicaid. Some states are pretty generous. Other states are pretty chintzy. We're one of the chintzy ones. And part of it, I think, has to do with philosophy. If you think that people on Medicaid are just, people who
Lazy.
could work and just don't want to lay around and, I don't know, do drugs or something, then you may not want to help them. The majority of people on Medicaid in Oklahoma are children. Many of them are families of veterans. So, it's, some of it is just some people don't like poor people.
Don't we have insurance for children?
We have S-CHIP, but not everybody is eligible for that. We have Insure Oklahoma, but again, there's a cap of 35,000 people. It's a maximum for the whole state. And even as a family, you have to make below 37% of the federal poverty level to qualify for Medicaid in Oklahoma.
Well, is that the reason then, when this is all settled and done, that so many millions of people are still not going to be covered by this?
Yes. It's because 25 states chose not to expand Medicaid. And also the problem with the undocumented immigrants, which there's quite a few of them, and they're not eligible at all. And again, that was politics.
The 8.5 billion over 10 years, that's the Medicaid we're talking about.
Right.
Folks, that's $850 million a year.
To pharmacies, hospitals, doctors' offices, so they can have more staff, so they can hire more people, so they can create good jobs. The Tulsa Chamber of Commerce has come out major in favor of this because their CEO is a hospital CEO too, so, you know, it's just, it's like shooting ourselves not in the foot, in the head.
I mean, we really get busy and want it that they could politically get.
Pardon?
If the people understand and really want it, then they could get busy and start.
And you know, my biggest fear, I'm gonna tell you, is that we're gonna have to wait until all these little hospitals are closed, and people are desperate. And, you know, when I was driving down here today, I'm driving down I-35, there was a complete stop at Norman. You couldn't get through, I sat there for 20 minutes of traffic. And I thought, you know, and coming the other way, there was a huge construction project. And I thought, what if you were trying to get to a hospital in Norman to deliver a baby because your hospital closed? It's insanity, and it's going to hurt everyone. And I will tell you, this is not just, I don't know, it shouldn't be a political thing. Representative Doug Cox, I don't know if you all know him, he's a emergency room doctor in Grove, which is where I did my fourth-year medical student residency and loved it. Or fourth year, they had an internship, I don't know what it was called, but anyway, I got to spend some time in the Grove Hospital, and it's a little, you know, community hospital. And he has come out and written editorials in Oklahoma that, you know, we need to do this. He sees those patients who come in. He sees what happens when people, and you know, I know this from my personal experience. People have a little, you know, skin cancer on their arm that takes about, you know, $150 worth to take off. But people don't get it taken care of and don't get it taken care of and end up losing the whole arm. What kind of country does that to its own people? It's crazy. So that's my editorial comment.
I know one thing about we have to be proactive as patients, because I had to get on the Medicare distance track. But, you know, the free things that they're going to do for us, a lot of the doctors and the nurses won't let you have that test because they say, oh no, we can't bring the Medicare will pay for that. So you have to take something in and say, I printed it off and I said, yes, I can have this test. Yes, they'll pay for it. Oh, well, fuck, I don't know. You know, just
In general, doctors tend to be change averse. They like everything to be the same as it was all the time. And so, and the thing they hate is dealing with insurance companies, dealing with Medicare. They want to take care of patients. They want to deal with, you know, the paperwork and that kind of thing. And so, you do have to be a proactive patient. And I know I've had a lot of friends that tried to get the shingle shot and were told, no, you can't do it. It's not covered by Medicare. And yeah, it is. It's covered under Part B. So, they're not always the best course. But the websites are great. So what do we do before the internet?
You have a question?
Yeah, we got, well, I need to say editorial side. You know, we have elections every 2 years, a representative or senator every 6. Get out and vote. See what you stand for. Don't vote for a party. Vote for what he believes. Vote for what you believe.
Amen. That's right.
I mean, just because the guy's a Democrat or a Republican, that don't make you agree with you. Get out there and vote for your candidate and look at what he stands for.
I think if, you know, I go to town halls, I always ask, and Representative Langford is our, when I can get recognized to ask a question, I ask about, you know, the Medicaid expansion, and I don't always get a 30 minutes.
Now, you said before that Medicare has not changed at all. Medicare, right, that's the old.
Minimally to covering
The
more
Advantage program
Medicare.
has a little bit.
The Advantage plans, they used to get an extra 17% surplus. When it was first started, it was billed as private insurance will save money. Well, then they found out that they cost more than regular Medicare. So they got Congress to appropriate extra money, so they were getting like 17% more than traditional Medicare. So this starts to take away some of those extra.
Some people I have heard, and I don't know, I'm asking you, you know, so I have heard that the basic medicine that people rely on under Part D Medicare the cost of those medications has increased because of this old Medicare.
Get you some papers.
Is that correct?
they never increased the mortgage.
That's just the meeting agenda from the
I didn't increase because because of, does the Affordable Care Act have anything to do with increasing Medicare prescription costs? And then another question too is, the one about cancer treatment for those over 75, that their cancer treatments are restricted because they're over 75.
My dad had Medicare, and he got, his cancer treatment up until he died at 85. So there's no truth to that whatsoever. I did want to,
Is that before this,
no.
so that hasn't changed since the Obamacare?
I'm going to say I have my uncle. The thing about cancer care when you're really elderly, some people choose not to do it, and I had an uncle who chose. He had bad heart disease too, and he had lung cancer, and he said, he had one chemotherapy treatment, and he was 80 of it. And that was like in December, so it's after the Affordable Care Act. And he said that he really didn't want to keep doing the chemotherapy. And so it should be a personal choice. And where that whole thing about death panels came up, remember that? It was because doctors do not get paid to talk to patients to ask them what they want. And this was a mechanism that was in the Affordable Care Act that got taken out to allow doctors to talk to patients about what they wanted if they became terminally ill, and to help them figure out what they wanted for their own power of attorney or will kind of thing. So the way it is now, if your doctor does that for you, it is out of the goodness of his or her heart because they're not going to get paid for it. And it was all thanks to the hissy fit that some people threw saying that was a death panel and it was ridiculous. I don't know why my computer isn't working.
Can an elderly person that maybe say they're 90 years old and they come down with cancer, can they be denied it if they want to go through health care? Because there's been
Through Medicare, if they're on Medicare
and Medicaid.
And Medicaid mostly pays for nursing home care for elderly people. This doesn't really affect that at all. So the nursing home part of Medicaid, where people who live in the nursing homes get health care, this doesn't affect that at all.
You see, I've heard that people can be denied if you're elderly. You can be denied health care benefits because of your age and the illness. And
Not true.
But the medication, you still get the proper medication and all of that, assuming your plan covers it and so forth. Is that true? I mean, even though you're 75 or 80 or 90 or whatever?
Yes.
Maybe to sum it up, is there anything, I guess we're talking about in Medicare, anything in Medicare that changed with the Affordable Care Act that reduces benefits as you mentioned? Nothing.
I've got a slide actually, if I can get down to it, that talks about, I have some supplemental slides that I had to edit out because this talk is so long, for which I apologize, but this is okay. How did Medicare save $716 billion, which, if you remember, was part of the 2012 campaign, but was also a part of Paul Ryan's budget plan. So, the reimbursements rise at a slower rate, and lower quality providers are going to start getting reimbursed less, which is an incentive for them to provide higher quality care. And we've already seen that the cost of Medicare and private insurance have been rising at the slowest rate in 50 years. So hospitals have a big financial incentive to improve care. And out of the Affordable Care Act, that was the $415 billion, and that was the slowing of the healthcare costs. And then the subsidies to private insurance companies was $156 billion. And, you know, one of the things called disproportionate share hospital payments, which is what many hospitals that took care of a lot of indigent patients were getting, it is going to pay less to those hospitals because most of those people should have insurance. It's not going to pay nothing, but it's going to pay less because most of those people will now get insured, especially because some states are expanding their Medicaid programs, so they're going to have a lot more people insured than states that chose not to do that. But that's a choice that Oklahoma has made, and we're going to have to live with unless we change it. So. Also, there's a lot of money, $89 billion, in fraud prevention. And you may have seen there's been a lot of activity on that, of getting some of the fraudulent providers who like get everybody signed up for wheelchairs who don't need it, and that bilking Medicare stuff, people saying that they were treating people for mental illness who never received patient scam artists, basically. So that fraud prevention has really gone into high gear.
If somebody signs up through the health marketplace and then they lose their job, if they can still come up with the premium, do they get to keep the insurance?
Actually, what they have to do, if your income changes substantially during the year, you have to let the marketplace know, and you may get a bigger subsidy if you lose your job.
But what if you lose your job, what happens if you have no income? Then you fall below that and you can't get Medicaid. If some family member is willing to pay your premiums, can you keep that insurance, or are they going to take it away?
That is an excellent question, and I do not know the answer to it, and I know that that's a subject of debate. Because there may be a difference between, you know, $10 between somebody who doesn't qualify for anything and somebody who qualifies for a lot of subsidies. And people, I have friends who work as freelancers and stuff, and they're ecstatic about being able to get this, but their income varies a lot. So what's going to happen to people who, I don't think they're going to kick a bunch of people off of insurance. I would be really surprised if that happened, as long as people pay the premium. I did want to mention real briefly that in spite of what you may have heard on TV or wherever, that the Affordable Care Act reduces the federal deficit over 10 years. And the way it does that is by raising some taxes. And the people whose taxes are being raised are the people who are funding a lot of these anti-health reform ads on TV, campaigns, whatever. There is an additional Medicare payroll tax on wages over $250,000 a year. So people who make a lot of money are going to pay a teeny bit more, not even 1% more. The capital gains taxes on unearned income, which is interest, dividends, again, there's a small tax for people who make more than $250,000 a year. So those people aren't happy about having to pay more taxes. And so they're funding a lot of the organizations that are fighting against this. Also, people whose insurance plans cost more than $27,500 a year, they have a small tax on only the part above $27,000. So if you are, Charles and David Koch, and you have a great health insurance plan that pays for your spa membership and, you know, a month at a retreat in the Caribbean or something, and some of those insurance plans pay for that kind of stuff, you're going to be paying a small tax on the part above that. So you're not going to be happy. And tanning, people who go to tanning salons, that causes skin cancer. So that's where the 10% tanning tax came in. So John Boehner doesn't like that one. Okay.
Well, there was an article on Channel 5, I believe, and it was just last evening that I saw this. And it was people that are on Medicare, and they're actually going to hospital emergency rooms just for chronic care. And that's all they said about it. That a lot of people that were on Medicare only were showing up at hospitals.
Are you sure you mean Medicare or Medicaid?
Medicare.
People over 65?
That were showing up for hospitals, emergency rooms, for just chronic care. And they were getting the care from the hospitals, from the hospital emergency rooms. And it was good care. And I didn't know if that had to do with the doctors or if they had doctors that didn't accept Medicare.
You know, part of the problem we've had in the American healthcare system is that a lot of people use emergency rooms. People on Medicare use them, people on Medicaid use them, people in private insurance use them. And everybody uses them a lot because what's the alternative? If you work and you can't take off from your job to go get health care, when are you going to do? And so we need some significant redesign in the way we do, having Saturday and evening hours at clinics and that kind of thing for people who can't just take off work. It's one of the experiments we did in the Air Force, one of the hospitals that I worked at, was we started a Saturday evening pediatrics clinic. We had a nurse practitioner who was going back to get her PhD in nursing. And so she liked to have her mornings off to go to bed, so she'd work in the afternoons and on weekends. And all of our pediatric traffic disappeared from our emergency room because now they have an alternative at hours that were convenient for the parents. So some of it is our healthcare system, and some of it, we haven't been, to be real honest, customer focused particularly.
That's so true.
Well, like the urgent care center and stuff here.
Yeah.
Because, I was out there not before last with the triplets, my grandchildren, because they had ear infections, and I didn't want to go to the emergency room, but that was one. Is that those kind of places, there going to be more of those kind of places because of that?
I don't know. I know, for instance, that most of the big drug chains like Walgreens and CVS, a lot of them are putting in nurse practitioners. Yeah. One time I teach a class for the American College of Physician Executives. I went to Dallas and when I forgot my blood pressure medicine, I was like, oh my God, it's Sunday morning. So I went to one of the CVS clinics and talked to that poor little nurse practitioner who really didn't want to do it. And they're giving me 10 of my blood pressure medicines to get me through. But I think those kinds of things are very exciting. I know Walmart has started kind of looking at some of the clinic models because private doctors' offices have not done a good job of providing community care. And it's tough enough when you're a doctor if you have, a wife and kids, a husband and kids, and hospital patients to manage the work-life balance stuff. And people burn out if they work too much and too hard. So I think some of those alternative delivery things are great. Nurse practitioners, I love them. PAs, I love them. We use them a lot in the military. They're fabulous, fabulous people. There's some really great ones and there's some really not so great ones. But that's true of doctors, that's true of everybody.
Somehow I thought there was money provided for those kind of
community health centers.
Yeah.
Community health centers, yes.
But that's not what that is.
That's
No,
like what's
that's an
that
urgent care, that's a for-profit
Okay.
thing. The community health centers are non-profits like Variety Care.
Okay.
We don't have any of those, do we?
There's one in
There's one in there.
There's one in
That's probably where the
Colorado.
navigator is.
The navigator is in the Lindsay Clinic, community health center on Main Street. And,
I think they're providing.
That's one scare.
excuse me, the navigator is on, in Lindsay at the community health center there on Main Street. And she also will come to Paul's Valley. She told me, on a regular basis, but I really don't know when and how, but that's probably something that we're going to be looking forward to let the community know about the navigator. But I think it may be another one, but she's the only one I have run across.
And at healthcare.gov, it will tell you some of the places in your area that may or may not have them. It's a little iffy. I know Planned Parenthood in Oklahoma City, they have them because I've worked with them.
But I think there's just one right now in the county,
In this county.
in this county out there, and I wanted to. Do you all have any more questions for Dr. Scheirman?
I have one more thing. I've got my little business cards with my email and my phone numbers and stuff, so if you have questions, if you have, friends or family who are having problems, I've got connections and, Doctors for America all over the country, so I would be happy to help anybody because, as I said, I truly believe in this. I think it's the best thing for people. So I would be happy to help if you want to email me. It's usually the best way to get me because I'm real bad about turning my phone off.
Thank you all for coming and coming to some of these refreshments if you don't mind. Get your refreshments.
No, but I'm on Medicare, so I didn't have to. I didn't have to. But basically, I just wanted to see how we can turn down that Medicaid money. Well, I'm sure there's stuff behind it that we don't realize. Too many other states are not doing it. Well,